I remember when we were first planning this resource center back in the olden days, 26, 27 years ago, and at that time the University of North Dakota was the only resource center we had within the Title VI program.
We really want to look at what were some of the social issues, okay? And then of course health is one of the major things. And at that particular time, we knew that we wanted to delve into research, but I don't think we really had a good handle on that initially. A lot of people probably don't realize this, but I was actually the first director of the program. I was kind of looked at more of a temporary director. I don't even think it was a year. We decided that Alan Allery, who did have a background in healthcare, I really think he gave it a lot more impetus, direction to the program.
He grew this program, and how he grew truly Indian aging, I think, throughout the country, because he was Alan Allery and he was so well respected and received.
I really think when Alan came on board, I really think the program really developed in such a way, and he was able to work with a variety of individuals. Dr. Ludtke really stands out. I mean, he was just tremendous in giving guidance, direction, a wealth of work and attention to this particular group. And again, Alan Allery is really credited for getting him involved.
I started out there as a McNair Scholar, and so I went back to sociology to my advisor who was helping me to get registered, and his name was Richard Ludtke. And he just happened to be the research director for the National Resource Center on Native American Aging. And then Alan Allery was the PI on the project. And it just so happened, unfortunately, is that Alan Allery passed away. And so when he passed away, then I had some talks over back at the center, and then they asked if I could pick up the PI piece of it. At the Center for Rural Health, we had great buy-in. From the School of Medicine, we had great buy-in. And from the University of North Dakota, we had great buy-in from what I could see. So I'm there for 11 years. I didn't really see a change in the mission. I've seen a change in regard to the activities of what we were doing and how we were approaching that. The strategies for how we were going to assist the native elder populations was changed because of technology.
We didn't know yet the value of data, but we were looking at trying to develop a data pool of some kind for the tribes to use in planning and managing their own programs. And that's how much of the work that you've been doing the last 25 years was born in response to our first thoughts about our needs for data.
I started my affiliation with the NRCNAA. I started as a graduate research assistant. I actually was approached by Dr. Russ McDonald, and he was working there at that time, and he was looking for GRAs. I moved into a research analyst position full-time after I had been working on my master's degree for a little while. And then I ended up as the director. I saw us go from a kind of a small data shop that was working with a relatively smaller amount of tribes and other indigenous nations and organizations to one that had this enormous national reach. It was really awesome to see the resource center kind of blossom like that. It really become a trusted partner with all of these tribal nations.
Became involved with the National Resource Center on Native American Aging around 2010 as a research specialist. TWYLA, Dr. TWYLA Baker then was our director and a wonderful leader. I stepped in 2013. It was a rather quick transition. I had to hit the ground running, but it felt natural. I feel blessed to have worked with all the Native elders. I mean, across the nation, Alaska, Hawaii. Our funders, ACL, had been consistently generous in funding the program.
Your director now, Dr. ADAMSEN, again, I've watched her when she was a student and first involved in this program, and how she has come to life and brought this resource center new life.
I've always felt that the predecessors of this program laid a really good foundation to continue some really good work that we could build off of. Throughout the past couple of years, developing more relationships and partnerships with other programs and entities to be able to work together to find new and innovative ways that we can help be a better resource for tribal communities, our tribal elders, our urban elders. Doing work alone is okay sometimes, but doing work together and partnerships is what makes things great. So I feel very fortunate and happy to be a part of this program, to be able to build off of that work that was done by others and to develop these partnerships with these other programs.
I've worked with all of your resource center directors over the years, and of course each person has put a little bit different spin and a little bit different focus on the work that you're doing, but it's been consistent that it's been to best serve Title VI programs.
We shouldn't be doing research just to do research. We shouldn't be doing research just to do papers. You know, we should be doing research in order to make things better.
Everything that we create at the Resource Center, we share. And they share their information with us. We would not have survived without sharing resources.
The work that we were doing helped to feed elders. And so that was probably one of the most fortifying things that I got to be a part of in my time there.
I think the growth that the Resource Center at University of North Dakota has gone through in the last 25 years has been pretty phenomenal. You've certainly grown from a tiny little resource center, and at first, 25 years ago in Indian country, we kind of didn't even know what a resource center was or what we could do with it.
There's such a need, and the people that are working with it, you know, probably are just so committed in working with the elderly that they should be commended. I think they're doing a great job.
We're really proud at ACL to be able to talk about the Resource Center and this data pool and the work you've done, because it's added so much to Title VI. You've chosen well, North Dakota. You've done very well in managing this Resource Center.